So axial skeleton, let us start with the axial skeleton. This part consists of the skull, then vertebral column, ribs and sternum. Together the bones forming this structure constitute the central bony core of the body, that is the axis of the body. So the skull, here you can see the skull that is raised upon the upper end of the vertebral column, and its bony structure is divided into two parts, the cranium and the face. So the cranium is again consists of the different bones and which is forming a cavity, and this cavity contains our brain, which is one of the delicate organ of our body. So this cranium is formed by a number of flat irregular bones that provide a bony protection for the brain. It has a base upon which the brain rests, and it has a cavity walled, that means the cavity that surrounds and covers it. The periosteum inside the skull bones consists of the outer layer of dura matter, and in the mature skull, the joints that is also called as the sutures between the bones, which are the immovable types of joints that are also called as the fibrous joints. So they have the different bones, the frontal bone, two parietal bones, two temporal bones, one occipital bone, one sphenoid bone, and one ethmoid bone. So all these form the skull. So here you can see the frontal bone, which is at the front side, anterior side, and this is the suture, that is the coronal suture, which joins the frontal bone and the parietal bone. Then the temporal bones, then parietal bones are joined by the squamous suture, while the lambdoidal suture joins the occipital bone and the parietal bones. The mastoid process is present here. You can see the sphenoid bone is present here, the nasal bone. Okay, the ethmoid bone is again which forms the skull. So all these are the flat bones and irregular shaped bone which are joined by the sutures. The facial part of our skull, which is forming the having the different bones like nasal bone, then the lacrimal bones, which are having here near the eye, which have the lacrimal glands, then zygomatic bones, which are having the cheek bones, then maxilla, which fixes the tooth of our ear, the tooth can see, then mandible. Okay, so all these forming the 28 bones, and inside here you can see the different uh, ear ossicles are present, which ear ossicles, three on left and three on right side. The six ear ossicles are there, which gives the total 28 bones, which forms the skull of our body, the skeleton, axial skeleton. So the next thing is what? Here you can see inner structure of our skull. Here the parietal bones, these bones forms the sides or and roof of the skull. Parietal bones which forms the, this is the side and roof of our skull. Then which is joined by the lambdoidal suture with the temporal bones and the squamous sutures. Okay. The inner surface is concave and is grooved by the brain and blood vessels. So here you can see the ethmoid bone is present, the sphenoid bone is present inside our skull. The inner structure you can see, this is the foramen magnum through which the our vertebral column is passing, spinal cord is passing, which forms due to the passage through the vertebral column. Then here you can see the different views, lateral view of our right temporal bone and the sphenoid bone viewed from the above. So here you can see lateral view means from the side. Side you can see this, the structure of our brain, skull looks like this. The here you can see the mastoid process, then mastoid part, external acoustic meters. It is external acoustic meters is nothing but what? It is our ears. What are these? This is a ear, external acoustic meters. Hmm. This is the zygomatic bone, that is the cheekbones. Hmm. So all this is shown here. The next is the face bones. So in this diagram, you can see the different face bones are present, which form the facial structure of our skull. That is the here you can see the nasal bone, then vomer, then the lacrimal bone near the eyes, then zygomatic bones, then maxilla, then mandible. All these bones are arranged together to form our facial arrangements. So here you can see the two zygomatic or cheekbones are present. One is maxilla, the two nasal bones, two lacrimal bones, one vomer, two palatine bones, two inferior conchi. Here you can see the inferior nasal conchi, the nose openings, then one mandible, as you can see in this diagram. Hmm. So the zygomatic bones forms the prominences of the cheek and part of floor and lateral walls of the orbital cavities. The maxilla or the upper jaw bone. This originates as two bones, but fusion takes place before birth. The maxilla forms the upper jaw, the anterior part of the roof of the mouth, the lateral walls of the nasal cavity, and part of the floor of the orbital cavity. So maxilla which forms the roof of our mouth. Inside when we open the mouth, you will see the upper surface. It is nothing but the maxilla. The nasal bone. The nasal bones, there are two small flat bones which forms the greater part of lateral and superior surfaces of the bridge of the nose. Okay, then the lacrimal bones you can see in this diagram here. These bones, the blue color bones which are present here, these are nothing but the lacrimal bones. So these lacrimal bones, you can see this is the lacrimal bone here near the eye cavity. So this lacrimal bone is present here and having the location. The lacrimal bone is associated with the lacrimal gland. Hmm. So there are two small bones are posterior and lateral to the nasal bones and form a part of medial walls of the orbital cavity. Each is pierced by a foramen or the passage of the nasolacrimal duct, which carries the tear from the medial canthus of eye to the nasal cavity. Vomer. The vomer is a thin flat bone which extends upwards from the middle of the hard palate to the main part of the nasal septum. Superiorly, it articulates with the perpendicular plate of the ethmoid bone. Okay, this is the vomer. So vomer, you can see this is the straight line bone. The vomer is a thin flat bone which extends upward from the middle hard palate to the main part of the nasal septum. So it divides our nose into left and right side. It divides our nose in left and right side. So this is the left side and this is the right side. Here you can see. Hmm. So this is all. Next are the palatine bone. These are the two L-shaped bones. The horizontal part unites to form the posterior part of the hard palate and the perpendicular parts projects upward to form the part of the lateral wall of the nasal cavity. So all these bones are forming the base of our skull. So here you can see this is the frontal bones which forms the face and that gives a specific facial appearance to our self, that is due to the palatine bones, then inferior conchi. Inferior conchi is nothing but inside this nose. You can see this is the nasal conchi here. The nasal conchi, that is inferior conchi inside it. Each concha is a scroll shaped bone which forms part of the lateral wall of the nasal cavity and projects into it below the middle conchi. The superior and middle conchi are the parts of the ethmoid bone. The mandible, This is the only movable bone of the skull. Okay, here you can see all these are others are fixed one. These are not movable, but the mandible is a movable. When we are chewing, you can see the movement of the mandible. So speaking and other things is only takes place by the movable bone. It originates as two parts which unite in the midline. Each half consists of two main parts, a curved body with a alveolar ridge containing the lower teeth, and the ramus which projects upward almost at right angles to the posterior end of the body. At the upper end of the ramus that divides into the condylar process which articulates with the temporal bone to form the temporomandibular joint, and coronoid process that gives attachment to muscles and ligament. The point where the ramus joins the body is the angle of the jaw. So this is the movable bone of our skull. So here you can see the structure, the diagram showing the body, then the angle, then ramus, then condylar process, then coronoid process, and this having the arrangement of the teeth and gives the facial appearance. So the next part of our axial skeleton is our, you can see the vertebral column, and this each diagram is showing the vertebral column here. It is a S-shaped structure, and this gives the posture to our body. Without this vertebral column, we cannot stand or walk anything. The structure which supports to our body is the vertebral column. So it is a very important part of vertebrates. Otherwise, we will be invertebrates. So there are these are the reasons of this vertebral column: the cervical vertebrae, then thoracic vertebrae, then lumbar vertebrae. Here you can see the lumbar vertebrae, lumbar region. This is the sacrum, and this is the coccyx. So in the vertebral column, there are the five regions: the cervical region, thoracic region, and lumbar region, sacrum region, and coccyx region. The last two, sacrum and coccyx, are get fused. So sacrum has a five vertebrae, but they are fused together to form a single bone, while the coccyx also has a four vertebrae, but they are fused together to form a single bone. So these are the five in numbers vertebrae, but fused together. So bone is the only one. Okay. The lumbar vertebrae are five in number. Thoracic vertebrae are 12 in number. Seven are the cervical vertebrae, and the cervical vertebrae form the neck region of our body. So the neck is also called as the cervical region. So cervical vertebrae 7, thoracic 12, then five lumbar vertebrae, then sacrum and coccyx. Okay. The next, here you can see the vertebral column consists of 24 separate movable irregular bone, the sacrum, five fused bones, and the coccyx, four fused bones. The 24 separate bones are in three groups: 7 cervical, 12 thoracic, and 5 lumbar. So near about the vertebral column have the 26 bones. That means the 12 vertebrae which are movable, while the one is the sacrum bone and the next is the coccyx bone that are fused. So the 12 vertebrae plus 2, 26 bone. Okay. The movable vertebrae have many characteristics in common, but some groups have distinguishing features. So here you can see the characteristics of typical vertebra. So typical vertebra has a specific shape or the structures which have, these are having the body. The body of each vertebra is situated anteriorly. Anteriorly means towards the front. Towards the front. The size varies with the site, that is the region. They are smallest in the cervical region and becomes larger toward the lumbar region. Means a typical vertebra that is having the anterior part. This is the towards our chest region, and this is called as the body. And these are the processes. And this is the vertebral foramen through which the spinal cord is passing. So a typical vertebra showing the different structures, that is the body, then different processes. These are the so different in names like transverse processes, then spinous process, then superior articular processes, and in the middle of this vertebra you can see this is the passage or hollow passage that is called as the vertebral foramen through which the spinal cord is passing. Okay, so this is the typical vertebra. So what is it? uh, the vertebra size may vary according to their region. In the cervical region they are small, while in the towards the lumbar region they becomes larger in the size. So the first is the, here you can see the vertebral or neural arch. That encloses a large vertebral foramen. So here you can see this has a vertebral foramen. So this is the second part of our typical vertebral foramen. The ring of bone consists of two pedicels that project backward to form the body and the two laminae. So in this diagram you can see these are the laminae, one on left side, one on right side. This forms our laminae and forms the spinous process. Now back side, it is the posterior region of our vertebra. This is the anterior region towards the chest, while the spinous processes are the back side. The neural arch has four articular surfaces. What is mean by articular surfaces? The articular surfaces means one above the other. They are joined to each other or fixed in each other, but having the movable structure. So here you can see the arrangement of vertebral column is like this. They are having the articular processes, and on this articular processes they are having the joining or rest on each other so that they have the flexibility in the movements. Hmm. So these are the articular processes each vertebra having. So some are transverse articular processes, then spinous processes, two articulate with the vertebral above and two with the below. So this is the, when one above the arrangement is there of vertebrae. So two processes join to the lower vertebra and two processes join to the above vertebra. So the vertebral foramina form the vertebral canal that contains the spinal cord. That I have told you that this foramen which have a passage of the spinal cord through that, uh, basically it protects our delicate nervous system, that is the spinal cord. There are features of different vertebrae by which we can identify them according to their location or the region. So special features of vertebra in different parts of vertebral column, like cervical region vertebrae. So they are called as the cervical vertebrae. So in the diagram you can see here the cervical vertebra showing typical features. So this is the anterior view which having the common structure, that is the body. Then two foramens. Here you can see the transverse foramen or the vertebral artery, and on the left side also there is a foramen. So through which the arteries are passing, and these arteries are supplying the blood to this region. So the passage for this artery is available here. on this vertebra. Then these are the pedicles here in this location, pedicle. This is the transverse processes of this cervical vertebrae, left transverse process, right transverse process. Then this is the articular side. Articular side means the joining side. Other vertebrae get joined, having their some portion joined together there on the vertebrae. But these are not fixed one; they are movable one. Then vertebral foramen through which the spinal cord is passing. So spinal cord starts from the brain and going downward towards the monkey bone, that is the coccyx, and having the originations of different cranial nerves. And these cranial nerves are again having the passage through this vertebra. The cervical region has a bifid spine. So here you can see the spinous process is single spatially, but in this cervical vertebrae you will observe that a bifurcated spine process. And this is the special feature of our cervical vertebrae. So the cervical vertebrae having 7 in numbers. The first two cervical vertebrae are atypical, means they are different in their structure and shape. So they are having different characteristics and different shape. The one is the atlas and the second is the axis. So atlas is the first cervical vertebra and consists of simply of a ring of bone with two short processes. The anterior part of the large vertebrae foramen, which occupied by the odontoid process of the axis, which is held in position by transverse ligament. So here you can see in this diagram the atlas vertebra as shown in this diagram. So it having a atypical structure. It has only a large central foramen, no processes, spinous processes present. The facet for articulation on the left and right side. The two transverse foramen for vertebral arteries are present. So this is what the space is required for the odontoid process, which is specific characteristic of again the axis vertebra of cervical region. So atlas is the first cervical vertebrae and the axis is the second cervical vertebrae. So they are fixed together as a pivot joint. So here you can see this odontoid process is inserted in this region so that our neck can move in left and right and circular motion. Okay, so this gives a 360 movement of our neck due to this odontoid process of the axis vertebrae. The odontoid process forms the body of the atlas. The posterior part is the true vertebral foramen and is occupied by the spinal cord. On its superior surface, the bone has two articular facets which form joints with the condyles of the occipital bone of the skull. So here you can see our occipital bone is situated on this atlas vertebrae and this is joined to get the movement whenever we are moving. Our atlas vertebrae is moving with the neck and it is moving on the basis of the axis vertebrae. So the axis vertebrae, it is the second cervical vertebra. The body is small and has an upward projecting odontoid process that articulates with the first cervical vertebrae in the atlas region for atlas vertebrae, and in that atlas, in that foramen, the odontoid process is inserted The movement at this joint is turning the head from the side to side. So this is a very important characteristic of our cervical vertebrae. It gives the movement, allowing the movement of neck. Otherwise, if it is fixed together permanently, the movement will not be possible of the neck. The next region of vertebral column is the thoracic vertebrae. The thoracic vertebrae again have the bodies and the transverse processes, have facets for articulation with the ribs. So we also saw that the axial skeleton has the thoracic cage, and the thoracic cage has the ribs. So the from the anterior side, the thoracic vertebra shall have the facet for the articulation with the ribs. So these facets are present here. You can see in the thoracic region, this vertebra is a different than the cervical region. So this is the anterior side. The body is present on the front side, and at the back side, this is the process, spinous process, which is going downward. There are the transverse processes are present, then superior articular process present. This is the region here you can see. This is the facet on where your ribs are attached. Okay, this is the facet. Hmm? And through here the vertebral foramen behind it, through which the spinal cord is passing, the arrow showing here. This is the foramen through which the spinal cord is passing. Okay, so it is a simple uh, structures are here you can see, and very important functions they are performing. The next lumbar vertebrae, they do not have any special features. Here the diagram you can see the 16.17. 16.17 as we have studied already. Then the sacrum, which is the fuse, this consists of 5 rudimentary vertebrae fused to form a triangular or wedge-shaped bone with a concave anterior surface. The upper part of the base articulates with the fifth lumbar vertebra, and which have the sacroiliac joint, and which is articulated downside towards with the coccyx, which is the fused bone of the four different vertebrae, coccygeal vertebrae. These are the terminal vertebrae fused to form a very small triangular bone, the broad base of which articulates with the tip of the sacrum. So here you can see this is the sacrum and the coccyx fused together. The 5 vertebrae are come together to form the sacrum and coccyx region. So this forms our vertebral column, and this is the section you can see through which our uh, spinal cord is passing, and the different cranial nerves are passing through this vertebral column spaces. The spinal nerves have the arrangement which through which the spinal cord have that nerves, the cranial nerves and spinal nerves, which are having the passage through this spine, our vertebral column. The diagram is showing the passage and arrangement of vertebral column with the spinal cord. Let us see the next again how the vertebral column is so much movable. So here the intervertebral discs are present. The bodies of adjacent vertebra are separated by intervertebral disc, which consisting of an outer rim of fibrocartilage and a central core of the soft gelatinous material, which gives a smooth surface for the attachment of the vertebra. So the vertebral column has some flexibility due to its intervertebral disc. and which have the shock absorbing function. This is giving the shock absorbing capacity to the vertebral column. The intervertebral disc, which are made up of the fibrocartilage and the gelatinous material inside. They are thinnest in the cervical region, means in the neck region they are thin, while in the thicker towards the lumbar region, the back of our vertebral column. It is thick in the lower region of the vertebral column, while thin in the upper region of the vertebral column. Then next, the intervertebral foramina that we also through which the spinal cord is passing. Then ligaments of the vertebral column. These ligaments holds the vertebrae together to help maintain the intervertebral disc in position. The transverse ligament maintain the odontoid process of the axis in correct position in relation to the atlas. The anterior longitudinal ligament extends the whole length of the column and lies in front of the vertebral bodies. So all these ligaments are keeping the vertebrae together. They allow the some movement in the vertebral column, but puts them together so that they cannot be segregated and having a shock absorbing capacity. The vertebral column has a different curves that we also saw, that I have told you, the S-shaped structure that is due to the curves of the vertebral column. The vertebral column has four curves. The two are primary curves and two are secondary curves. The fetus in the uterus lies curled up so that the head and the knees are more or less touching. This position shows the primary curvature. The secondary cervical curve develops when the child can hold up his head after about 3 months, and secondary lumbar curve develops when he stands upright up to 12 to 15 months. The thoracic and sacral primary curves are retained. So these curves has been shown here. The primary curve when the fetus is in the womb. This is the primary curve. So the head and the knees are near. Here the first secondary curve develops the cervical curve in the first 3 months, and the latter the thoracic curve, then the secondary curve, lumbar curve, and the sacral curve develops in the later on up to the 12 to 15 months. So as per our growth takes place, the curves develops of the vertebral column. The movements we have discussed earlier, movements between the individual bones from the vertebral column are very limited. However, the movements of the column as a whole quite extensive and having the bending, that is flexion, extension, then lateral flexion, rotation. Okay, all these movements are allowed in the vertebral column. There is a more movement in the cervical and lumbar region than the elsewhere. So our cervical region and the lumbar region has a more freedom of movement than the other regions of the vertebral column. The functions of vertebral column, collective functions, the vertebral foramina gives the passage for the our spinal cord, delicate spinal cord. Then the pedicles of the adjacent vertebra form the intervertebral foramina and gives providing the access to the spinal cord for spinal nerves, blood vessels, and the lymph vessels. It supports the vertebral column, supports the skull. The intervertebral disc act as a shock absorber, protecting the brain. It forms the axis of the trunk, giving attachment to the ribs, shoulder girdle, upper limbs and pelvic girdle, and lower limbs. So this covers our vertebral column and gives support to our body